So, Dr. Montero Lopez, if you had a patient who was feeling aches in their hands and really enjoyed knitting, what would you say to them?
So typically my goal is always to keep people doing the things that they enjoy doing. So if you enjoy knitting, if you enjoy cooking, gardening, anything that really involves the use of the hands on a regular basis, my goal would be to try and get you to break down what portion of that activity is really causing the problem. So for some people, it's just that they try to do these things for hours on end. And then as like hour one turns into hour two, turns into hour three of knitting, their hands are just really, really achy, and that's just overuse. So sometimes it's just modifying the length of time you're trying to do something. For other people, it's trying to modify, how you're doing it. So the way you're gripping something, the way you're gripping a knitting needle, the way that you're gripping a pot or a pan or a knife. Just trying to find a different way to do the same thing that you like, but in a way that isn't stressing the body part that is currently hurting. Especially in the case of somebody who's got arthritis, you can't really undo arthritis. It's like a scrambled egg. Once it's scrambled, it's done. We can treat it, but we can't make it back the way that it used to be. In the case of something more like an overuse or a tendonitis, that's a little bit easier in the sense that typically if we get you to pull back, even if it's just temporarily, it will improve. The other thing to pay attention to is there anything that you can kind of substitute for, the thing that you like doing? So if, you like knitting, but, maybe needlepoint or crocheting or something similar, but not exactly the same with like a smaller set of needles or a smaller device is more comfortable for your hands, but you're achieving something similar. It's just kind of being mindful of like what specifically in the activity that you like doing is causing you to be in pain. And not necessarily just pushing through it, but really thinking about it and kind of trying to identify ways to make it more comfortable. And not only is it's not something you have to do on your own. Typically people come in and they're like, I try to do this and it's hurting. And then it's not until I point out like, okay, so when is it hurting? Is it hurting the whole time? Is it hurting right when you start? Is it hurting towards the end? Is it hurting with a specific wrist movement? And when you start to break down these movements into their smaller components, it gets easier to figure out where exactly we need to address the problem. Where can we modify it? So yeah, I don't think the answer should, there's always the possibility that the answer is going to be you have to stop doing this because you're injuring yourself further. But more often than not, it's you have to modify this.
Got it. Thank
Yeah.
you.